Hello, and thank you so much for joining us across the Organization of Eastern Caribbean States, the OECS. A warm welcome to the studios of ABS Television and Radio in St. John's, Antigua. My name is Garfield Burford, and this is COVID-19 Vaccines, a healthy dose of the facts. Now, over the next hour, we are injecting truth in the discussion by addressing fears. We're taking a factual and fair look at COVID-19 vaccines by talking to some of the sub-region's finest medical professionals, in addition to others who have extraordinary stories to tell about their own encounters with the insidious invisible enemy, SARS-CoV-2, the virus which causes coronavirus disease 2019. We really appreciate your company and urge you to engage with us on our social media platforms throughout today's program. First, let's examine how the virus and its variants have impacted the sub-region comprising 7 protocol members and 4 associate members. We begin with a look at the state of affairs in Grenada, which has been one of the member states seeing a nightmarish rise in cases and deaths in recent weeks. It's a sad and grim situation in the Spice Isle. We spoke earlier with Chief Medical Officer in Grenada, Dr. Sean Charles. Take a look.
Well, my name is Ursula Charles Jr., and thank you for joining us for this extra special conversation with the Chief Medical Officer out of Grenada, Dr. Sean Charles, who joins us now via virtual means, of course, to discuss the very latest on COVID-19 in that country. Dr. Charles, good day, and thank you so much for joining us.
Good morning to you, and thank you for having me.
Very welcome. Let's get your impressions of the COVID-19 situation in your country. Of course, a situation that's permeated the entire OCS region.
Right. So the situation at present here is one of concern. We have been one of the few countries to hold out without any significant spread of the disease for some time, and then recently, I think just over 4 weeks, maybe 4 going on 5 weeks ago, we started experiencing an explosion of cases. Of course, we were able to discern that the likely variant that is circulating here at present is the Delta variant from samples that we sent to the Caribbean Public Health Agency. And it is of significance that our first real wave of COVID-19 is caused by one of the most severe variants, one of the most contagious, and one that can rapidly lead to, can cause patients to deteriorate quite quickly, and especially if they're not immune. So, I mean, this is our summation of what has resulted in the circumstance that we have. So to date, we have just over 4,600 cases confirmed. But of course, we know in surveillance, this is just a fraction of the cases that are actually out there. And we have had quite a number of deaths as well, just under 100. So the situation is concerning, but we're managing.
It does seem disconcerting. How are you managing, though? Contact tracing efforts, how have those been going? And in terms of adherence to those public health protocols that you as a CMO and, of course, your Ministry of Health would have been implementing throughout the entire country?
All right, so community spread began very quickly, all right? And we soon discovered that when you find one case, there are several other persons who are contacts of that case and were already infected. And one of the other discoveries is that this disease spreads very readily in the home environment. So all of this has contributed to the picture to the picture that we're seeing. So much so that it is not possible in many cases to identify the link between cases. So we have right now a deeply established community spread.
In terms of the public health protocols in place and perceived adherence to those protocols.
Right, so this is one of the areas that, was most challenging for us. Being one of the countries where for a very long time we've had literally no cases. There was a level of complacency that was developed in the population. Persons simply believed that none of this could happen here. So they went about their daily lives as normal. Adherence to the public health and social measures was not very good. To summarize it, it was not good. Many individuals were not wearing masks, even though we have the wearing of masks in public places right there clearly outlined in our public health laws and public health regulations, and even emergency powers regulations. Many unsanctioned gatherings with very limited adherence to any of these public health protocols. And uptake of vaccination was really not very good. We entered this phase of our COVID, of our epidemiological situation. We entered this phase really with a vaccination coverage of less than 20%. Right, so we had, what we described as a perfect storm of conditions that favored the outcomes that you're seeing right now. We had very low vaccination coverage. We had a population that really was not adhering to any of the public health measures, and we have a strain, we have a variant, we have the development of variants that are becoming more efficient at being transmitted from persons to persons. So when you put all these conditions together, you get the outcome that you're seeing right now.
Sean Charles, CMO there in Grenada, thank you so much for joining us at this hour for this important conversation. We wish you, all the other healthcare workers, and the entire healthcare system the best as you try to deal with the rising numbers of cases in your country.
Thank you.
All right. Well, my name is Ursula Charles Jr. We've been speaking to Dr. Sean Charles, Chief Medical Officer in Grenada. We now throw you back to Garfield Burford in our studios.
Our thanks to Ursula for that interview. Powerful interview there with Dr. Sean Charles, the CMO in Grenada. We commiserate with those who have suffered loss from the viral infection in the Spice Isle and the entire sub-region, and we hope for a turning of the tide. Now, health officials tell us the region is in a race against time to prevent health systems from collapsing, to prevent more infections, hospitalizations, and deaths. It was William Shakespeare who said in Julius Caesar, quote, "There is a tide in the affairs of men, which taken at the flood leads on to fortune. Omitted, all the voyages of their life is bound in shallows and in miseries. On such a full sea are we now afloat," end quote. Are we at such a consequential moment, therefore, in the response to the pandemic? Are we at such an inflection point? Now, this takes us into another of our major interviews this afternoon as we unpack all you need to know about COVID-19 and COVID-19 vaccines. Are vaccines the silver bullet we need in the response to the pandemic? So joining us now is Dr. Tanya Destin Boburn. She's one of the doctors on the front lines of the battle against the virus in St. Lucia, and she joins us on Zoom to talk more about these developments, certainly in terms of what's happening in St. Lucia, what she's been seeing. She's a family physician there in St. Lucia. Thank you so much for joining us, Dr. Destin Boburn. Now let's start off here. How are they helping in St. Lucia? What has been your experience as a family physician?
Well, first of all, I just want to acknowledge those who are working in the respiratory hospitals all over the world, and especially in the Caribbean with our limited resources. As a family physician in private practice, I have seen COVID from, I guess, its beginning. But in the past 3 weeks, I've had a quite unique experience, well, for me anyway, in that I had about 8 patients test positive for COVID. Some of them were vaccinated and some were not. The majority of those who were vaccinated gave me very few problems. We managed at home with having their oxygen levels checked every few hours. You know, thank God for technology like this, that we could actually have teleconsults with them and see how they were breathing and actually speak with them and you know, have some eye on the ground, so to speak, to see how they were doing. However, 3 of them were unvaccinated. One is in hospital, was severe. I think she's been upgraded now. The other one at home is stable, but I will tell you that last week I shed some tears because I was scared. I wasn't sure if that patient would make it because things were just so unstable with him. I didn't know if he was. And the other one had the respiratory symptoms, but they were not severe enough to take him to hospitals. So my personal experience is following what we're hearing out there, in that vaccines are saving lives, and the vaccines are allowing us to manage patients at home and preventing hospitalizations and death. So I know that we've had these issues before and people have said so, but it's one thing hearing it and understanding from my colleagues all over the world that they are seeing it as well. But my personal experience in the past 2 weeks brought it sort of to my face.
Have you been seeing, Dr. Boburn, any sort of breakthrough infections? And is this in a way undermining the person's confidence possibly in the efficacy of vaccines? Have you seen any sort of breakthrough infections?
Well, I don't like to call it breakthrough infections because it sort of intimates that we didn't expect infections with the vaccine. At no point in time did anybody say that vaccines would prevent infection. No vaccine does that. We've had measles, children who have been immunized with measles, mumps, and rubella come up with measles. You know, we've had children immunized with chickenpox who come up with chickenpox. So we know that there are chances of infections even if you're vaccinated. However, what we know is that the vaccines, because of how they work by priming the immune system, the infections are milder, fewer complications, and the duration is usually shorter. So we are aware that the COVID vaccine will not work as well as people thought they would. But we're also seeing that the benefits are, one, they are less likely to get infected. And if they do get infected, they are less likely to transmit the infection. And if they do come down with the infection, their disease progress is milder and shorter. So yes, we are seeing what people are calling breakthrough, but I wish we would choose another term for them, for these infections.
Okay, all right. You don't like to use the term breakthrough infections. You're saying essentially, let's be pragmatic about it. Let's talk about the fact that there is a possibility of infections, but the truth is that somebody who is infected, who's been vaccinated, has a much better outcome, you're saying?
Yes, for sure. That has been my experience in the past 2 weeks. Like I've seen it up front and been able to actually document the few patients that I've managed. But that brings me to something we need to talk about called immune resilience.
Yes.
we need to know and understand how the immune system works, because the COVID disease is really a disease of the immune system. So we've been talking about preventing the disease, which is wearing the mask, sanitizing, coughing or sneezing into your elbows, maintaining physical distances, staying home, the usual, to prevent you getting exposed to the virus. Then we have the other arm, which is the vaccines, which we know are actually helping to mitigate the severe diseases. But we need to talk about the immune resilience, which is boosting our immune system so that, one, if we get if we get the disease, we're better able to fight it. If we get the vaccine, and if we choose to get the vaccine, our bodies are going to work better because our immune system is just working better. So you get a better response to the vaccine. And if, for instance, you get that infection, your immune system is working so well, whether you're vaccinated or not, that you're going to get hopefully a severe form. But immune resilience, along with the vaccine, seems to be something that together really does help the patient stand a better chance of getting through the disease in a milder way.
Excellent. Immune resilience is a very good term for talking about that, and certainly it's an area that we have to look further into. Let's talk about what you've been seeing in terms of the empirical evidence, Dr. Bobrun, and why is it that if we have such empirical evidence, why is it that more people across the sub-region and across the wider region and across the world are not, essentially rushing to take the vaccines? Why is that the case? Why are we seeing still vaccine hesitancy?
Honestly, I don't know. And it's something that I wish I had the answer to, because if we knew what we were dealing with, we could try to address it. I mean, there are some people who have honest reservations about the vaccine because it's what they think it's a new vaccine. But the technology for these vaccines are the same for the AstraZeneca vaccine. It's the same technology that has been used for all the vaccines we've been giving our children for years. So it was just a matter of changing the vector, which was the coronavirus, so that these vaccines could work. The mRNA technology was already in the pipeline for other things. They just shifted and pivoted and used it to fight the coronavirus. So I think it takes an understanding of how the vaccines work, which we have gone into ad lib over the past few months. But I also think people need to understand that for every life lost, especially life lost to COVID that we think could have been prevented, leaves a hole in a family's life. It's somebody's a parent, a child, a treasured family member and a treasured part of the community that's just been taken from us. And in my opinion, if there was a chance that this person could not have got to that stage, why aren't we doing whatever we can to protect each other? Because you may be young and healthy and your immune resilience may be at a high level, so you may get a mild form of the disease if you choose not to get vaccinated. However, you are more likely to transmit it if you're unvaccinated to somebody who's more vulnerable.
Fair enough.
This is what is happening. The elderly people are staying home and trying to follow the protocols, and people are actually bringing it into their homes. I've seen it happen. So yes. I think this takes into account community and how are we taking care of each other. And one of the things to do, in addition to following the protocols, is getting vaccinated to protect somebody who's more vulnerable than you are.
Yes, we have a very tight time frame, Dr. Bobrun. I'm pretty sure that there are a significant number of questions online which we want to be able to take a few of them to be able to, to have you respond to them. But let's ask you this one. Since we're on a matter of time, let's deal with that issue. Does the region have the luxury of time in terms of getting vaccinated, achieving herd immunity? Because there are some individuals who say, Dr. Bobrun, that, look, I'll wait and see. I'll wait to see what happens for other people. When they take the vaccine, let's see what happens to them first before I decide to take it. Do we have the luxury of time?
We don't have time. We don't have the luxury. We lost that. We're small islands with limited resources. Our healthcare services Most islands are already overburdened. Our healthcare workers are already overburdened. We've lost so much. We've lost, our economies are unstable. People's livelihoods are still in limbo. We can't take much more. And I will tell you, today I told somebody, we are not good. Because the longer we stay in curfews and lockdowns and isolated, we face another issue that we're not looking at, is a pandemic of mental ill health. Because people are stressed and anxious and worried, and that these things are exacerbating our patients with chronic diseases. We don't have the time. We don't have the resources. We don't have the healthcare systems that can tolerate it for much longer. So we just don't have it. Time is we're losing time as we speak, and we have to sort of make some tough decisions as a community.
Yes, let's look at the issue of time in this context, Dr. Boburn, the issue of the mutations of the virus, because is it fair enough to say that the more the virus continues to transmit, the more opportunity it gets to mutate, and possibly one of those mutations might be so deadly, so virulent that it achieves some sort of immune escape? Is that fair to say?
Well, I think it's more than fair. If we look at how viruses work, if we continue that the way we've been doing, more than likely one of the variants will pop up that will we just won't have something to fight it. And every single time the virus is spread into a body because of how the virus works, there's an opportunity for the virus to mutate. That's how they survive. That's what they do. We need to stop them. And this is where the immune system is so important. And that is where we prime the immune system with the vaccine. And we eat well and we exercise and we stay well on the other hand and practice the protocols. And together we can fight this. If we do that, more of us do that, and we're consistent and we are invested in doing it. Right now, I don't see enough of our community invested in this.
Let me ask you a final question, Dr. Boburn, on this, because we're rapidly running out of time. You're a family physician in St. Lucia. What are those individuals who say, look, my immune system can handle this. I don't need a vaccine. What about those individuals who say, I take my multivitamins, I exercise, I eat well, and I use, naturopathic remedies and so on. Is that alone sufficient to fight off COVID-19 infections?
I don't think so, based on my experience with some of the patients I've seen over the past 6 months or longer. Some of the patients who were critically ill were those patients I thought were actually healthy. That was pre-vaccine times. So those patients of mine who who got COVID and had to be hospitalized or were really critically ill or severely ill at home were those that I thought, were in pretty good shape. So I don't think we have the luxury of saying things like I'm a healthy young person, because we just don't know. Because of how the virus works, it attacks every cell in all the critical areas of the body, the lungs, the brain, the heart. You don't know at which point that your body is going to give way and you're going to have severe hypoxia and you can't breathe. And so we just don't know. We don't know what the inflammatory response, how bad it's going to be when you have the cytokine storm. And at what point are you going to just be so severely ill you have to be hospitalized? So I want to encourage people to continue taking care of themselves and boosting their immune systems and taking their vitamins and eating properly. But I also want to urge people that you may not want to take the vaccine if it's because it's a foreign substance. But you're also the one carrying an iPhone or a smartphone that is pumping us with radiation and is toxic. We're also the ones drinking soft drinks that has chock full of sugar and other dyes and chemicals. We're eating the fast food that is certainly not good for our heart and brain. So I don't get it. If you are telling me you don't want to put this toxic substance into your body, then please do whatever you can to protect yourself by eating clean, whole, unprocessed food and exercising and so. But I'm not seeing that. I'm not seeing the impetus and for the people to do that. I'm not seeing enough people taking, control of their health in a way that they should, while they poo-poo the vaccines or they wait for us to get herd immunity. It's just not going to happen. We have to do all we can to
Powerful and
fight it as
profound.
a community.
Yes, powerful, profound, and thought-provoking point. Dr. Tanya Destin Boburn, we really appreciate you joining us. Thank you so much. Thank you so much for all the work that you've been doing in St. Lucia as a family physician, and of course, across the sub-region, not only in St. Lucia. And thank you for your message today.
Thank you for having me.
Indeed. That's Dr. Tanya Destin Boburn, who is joining us there from St. Lucia, talking about the impact of the coronavirus in St. Lucia, and urging everyone across not only St. Lucia, but across the sub-region to get vaccinated. Now, this takes us to an update on vaccination numbers across the OECS. Take a look at this.
Welcome. My name is Dr. Avian Bamodu, Program Director of Health at the OECS Commission. Thank you for joining us today. Vaccination is extremely effective against the deadly COVID-19 pandemic. Globally, as of the 24th of September 2021, there have been over 230 million confirmed cases of COVID-19 and over 4.7 million deaths. In the region of the OECS, there have been over 123,000 cases across the protocol and associate member states. And over the 2-year pandemic, most of the cases and deaths in our region occurred within the last 2 months. There have been significant increases in confirmed cases in Dominica, St. Vincent and the Grenadines, St. Lucia, Grenada, and Anguilla. The waves of COVID infections translate into waves of severe illness, hospitalization, and deaths. However, where vaccine rates are high, severe illness, hospitalization, and deaths remain relatively low, even during a COVID spiking transmission. Since the COVID-19 vaccines became available, countries are in a race to vaccinate their populations. The more developed countries have greater access to vaccines with levels of vaccine and higher levels of vaccine acceptance. Our World in Data provides interactive, customized graphics which tracks the vaccination rates by country relative to population over time. Within the OECS, Anguilla is the most vaccinated of the OECS countries, with approximately 60% of its population fully vaccinated. This is followed by British Virgin Islands, with approximately 45% of its population fully vaccinated. Next, St. Kitts and Nevis, with 41% of its population fully vaccinated. Next, Antigua and Barbuda with 37%, Dominica with 29%, Montserrat 28%, Grenada 18%, St. Lucia 16%, and St. Vincent and the Grenadines 12% of their population fully vaccinated. The OECS Commission joined in solidarity with the call for vaccine equity and vaccine confidence for our sub-region. Vaccination is extremely effective against the deadly COVID-19 pandemic.
Our thanks to you for that update. And a quick update from Antigua and Barbuda. The number of those fully vaccinated has climbed to 40.6%. That was as of last Friday. There has been an uptick in vaccination since the Gaston Brown administration introduced vaccine mandates for employees in the public service. Let's be clear, though, there are still many people across the sub-region who are not quite sold on vaccines, still skeptical, still have questions that they want to have answered. Now, here's a story of at least 2 individuals who are absolutely now sold on vaccines. They're encouraging you with this message.
Well, I was employed in Grenada. So I went in the States for 8 weeks to see my mother, who wasn't well. And it ended up to be 7 months lying down on my back in the States, cannot do nothing. Yeah, like the COVID take me up there. It caused me to go in the hospital. I spent about 2 weeks there unconscious. I don't know when I'm going to the hospital. I was unconscious. And I spent 7 months because he had like a problem to come back, with this flight and so on. I spent 7 months just lying down, cannot do nothing in America. And it was very frustrating for me. It is something dangerous. Right about now, I cannot walk again. It damaged all my hands and my feet. And I'm just struggling with it. Trying to do a little exercise now and again, to keep my body fit, but I cannot walk again. I recovered in the hospital because I didn't know when I go in the hospital. Because like the COVID, it bring up my sugar. It bring up my sugar up to 400 and something. So like I did die. And with the experience, girlfriend, I'm a child of God. While in the hospital day, I felt, like when the Lord, you die, and the Lord just come and He lift you up, and He tell me, He giving me a second chance. So I'm living here on a second chance because I know they die. Because they all believe that they die. Because I didn't know nothing, I don't know when I reach in the hospital. Because when they take me from the upstairs, it's a small step like that, narrow like that. Ambulance come and take me up, and I don't know. I was urinating on myself. I was passing feces and things of myself. It was very embarrassing, But I did went through a lot. And my prayer is that people should do what they have to do because this thing is very dangerous. I had a lot of discomfort because one time I could not have passed stool. And it was very painful. Very, very painful. I used to be bawling in the hospital until I don't know what they give me. I don't know because I don't know the medical name. They give me something that when I start to pass, I'm passing too much. Every minute, them nurse have to come and clean me up, which was very embarrassing for me. So I did went through a piece. As a man, I'm a skillful electrician. I love to walk, and I cannot walk. All now I cannot walk.
So you are fully vaccinated. So you think vaccination, of course, made the difference between life and death for you?
Without a doubt. Certainly. I'll tell you why. I was able to see the X-ray because when you on the when you taken into casualty, they'll do your X-rays and everything. I had seen some X-rays prior to I being hospitalized. Yes? So I had seen some because, again, by virtue of my involvement with CAFA and so on, and I happened to see some X-rays of it. It was comparative. Persons who were vaccinated and who weren't vaccinated. Luckily, I happened to see mine likewise. I will sit here right now and look at you straight in the eye and tell you, get vaccinated. I believe and I'm convinced, and I told my CAFA colleagues that, and I'm going to repeat it here again. Had I not been vaccinated, Kevin Frederick, would have been deceased. I would have been a dead man. Because the vaccines did prolong my life. It did help me to ride through this episode of COVID. I was having that difficulty breathing. Yes, my temperature was up there. I was practically weak. I have my underlying conditions. Why am I still here? The reason why I did not develop pneumonia, right, is because the vaccine prevented me from developing pneumonia. I didn't. And I saw other people on the ward who came in and they had the pneumonia and in tutus. That was it. I had witnessed people die. I'm talking about unvaccinated people. You know, I witnessed them die on the ward. So no one will sit out there and tell me that that is not real. I was on the ward. I saw people die. I remember seeing Dr. McGinn. There's an African doctor likewise, and I don't remember her name right now, but is the head of SGU's nursing program. That Saturday, working on a lady. The lady was unvaccinated. She had a load of underlying conditions. Unfortunately, she died. You know, so I would just say it again. Had I not been vaccinated, I sincerely believe I would have been a dead man today.
What extraordinary stories those have been. Absolutely profound and powerful stories, wouldn't you agree? Now we continue to deconstruct and demystify COVID-19 vaccines, arming you with the facts to make informed decisions. Our next segment focuses on whether vaccines are working to reduce transmission, hospitalization, and death across the OECS. We're traversing the archipelago, and we go now to the nature isle of Dominica, where we connect with Nurse Mignon Rule Shillingford, president of the Dominica Nurses Association and the head of health promotion. Thank you so much for joining us, Nurse. Really appreciate you making time for us here. Let's start off here. What vaccines are available in Dominica at this point, and what's the take-up like?
Okay, good afternoon, everyone, and good afternoon to the listening public of Dominica and the OECS. I want to take the opportunity to just, big up, the healthcare workers who are on the field today at the COVID complex, at testing sites across the island, vaccination sites, and at our main hospital, the Dominica China Friendship Hospital. And what we have available at present is the Sinopharm, the Oxford AstraZeneca, and the Pfizer vaccine, which we received sometime last week. We began our rollout on Thursday, and of course we will be going into our schools, because as you would know, that the Pfizer vaccine we can give has been approved to be given for children between the ages of 12 and 17. So this is what we have thus far. In terms of our uptake of our vaccines, of course, I wish that it would have been greater, but at present, we have a total of 23,860 persons who have received at least the first dose of vaccine, and of course, 21,217 who have received both doses of the vaccine. And in terms of the adult population, that's about 51% of the adult population who took the first dose, and 45.2% of the targeted population are now fully vaccinated. But of course, we're going to have a slight change in terms of our target population, because as I just mentioned, we now have the Pfizer vaccine, which will be rolled out in all schools across the island. And of course, there is an additional group when we calculated about 1,400 students who reached that group. So of course, our percentage in terms of who will be able to take the vaccine will change a bit.
Okay, all right, very good. And we thank you for your work there in Dominica in terms of being on the front lines, Nurse. So let's talk about this as well. Have you been seeing evidence that the vaccines are working to reduce transmission, hospitalization, and death from COVID-19?
Yes, most definitely. And what you'd realize with our dashboard of our COVID-19, that right now, of course, with the Delta variant, just like most of the other Caribbean countries, we have a significant surge or increase in the number of cases. So, for instance, at maybe about a year and a half ago, we had a total about 210 positive cases of COVID. And now we are above 3,000 cases. So over the past 2 months, we have had about a 14-fold increase in that period of time of COVID-19 infections. But what we have also seen, and which is very good data, because I know a lot of persons have been waiting and wondering, does this vaccine work, and how will it assist me, and they have been listening over. But I can say that it has definitely been working. And I just want to give some quick factual information coming off from our COVID unit. So for instance, as of the 23rd of September, in terms of persons who presented with severe cases of COVID, 98% were among the unvaccinated persons. So 98% of the persons who were presenting with severe COVID symptoms were unvaccinated. In terms of moderate cases, we had 90%. So 90% of those who presented with moderate cases are unvaccinated. And in terms of mild or an asymptomatic cases, 88% of that category were unvaccinated persons. I also want to say that we moved from 0 deaths to about 2 months ago to having 15 deaths. So we have had 15 deaths thus far, and all 15 deaths are among unvaccinated persons.
Those are very profound figures. With this information, Nurse, why is it that we're still having vaccine hesitancy in Dominica? What are some of the reasons that Dominicans have for not getting vaccinated?
So one of the reasons that jump out to me and has been jumping out is that they believe that the vaccine was made too quickly, and that it may not have gone through the normal procedures that of development of vaccines. And I want to continue to reassure the public, of Dominica and also the other Caribbean OECS countries, is that all of the vaccines that have been given emergency approval or approval, as in the case of Pfizer, have gone through the stages of development. And what are the stages of development? One, there's a computer algorithm that is used to model how the vaccine will interact with your immune system. So first it's a computer algorithm. Then it is tested in cells in a culture, and that is in a test tube. Okay, so I know you remember when you did science at school, there were different things that you would do in a test tube. So that's what happened. From there, when they are satisfied with the information they get, they move to testing on animals. After animal testing, that's when they move to human testing. Now, this human testing is done in 3 stages, where they check the efficacy, they check to see how it works, what's the possible impact on humans, and all of that. And these are done by many different, gross different countries. This information, when they are satisfied now, is put together and sent and applied through the different licensure agency. In the case of America, is the Food and Drug Administration. And of course, in other countries, all those who are responsible for allowing this to be used and used. So the vaccines that we are receiving now, that come from WHO, PAHO, and approved by this agency, all of these have gone through these stages of development.
Let me ask you a penultimate question, Nurse, and thank you so much for the information that you're giving us. In terms of side effects, some individuals are a little bit worried about side effects. What have been the side effects that you're seeing in Dominica, and what's your response to those individuals who say, look, I'm concerned about side effects of vaccines?
Yes, so what we have been seeing, and I would like to speak to the science of what is happening, and we have seen side effects that are not uncommon to the normal side effects of all vaccines that we give. So in terms of that redness around the site, tenderness, a little swelling, fever, we see some headache, these mainly, and sometimes we see some gastrointestinal disturbance. And these are the different side effects we would normally see in persons having vaccines. So even when we vaccinate our children, and of course there are many vaccines, over 20-something doses of vaccines that we give our children. That's the BCG, the MMR, measles, mumps and rubella, diphtheria, tetanus, all those vaccines that we give our children, that they do have, and that's why we tell you, have a little paracetamol at home. The baby may be a bit irritable, the area may be tender, they may have swelling, and this is exactly the side effects that we are seeing. Of course, we have always put things in place that in the event that someone develop severe allergic reactions, but we are not seeing many of those at all. We have not had any anaphylaxis, which is a major reaction to the vaccines. So these are all of the signs and symptoms that we are seeing, just as in any other vaccine.
All right, Nurse, we did say that was a penultimate question. Unfortunately, we have to skip the last question because we're really out of time, but you have been a treasure trove of information for us. Thank you so much for your work in Dominica. We thank you and all the other health workers who are on the front lines and continue to do good work. Thank you.
Thank you very much, and thanks for having me.
Indeed, all the very best to you indeed. Well, so as the nurse has indicated, Vaccines have been working in Dominica, and her message is very clear about continuing to encourage everybody to take COVID-19 vaccines. When we come back from this short segment, I will continue to ask you to stay with us because we're now going to be joining some other individuals who have testimonials about their own experience, their own encounter with COVID-19 vaccines. And then we'll be joined by another powerful medical figure in this operation, Dr. Rhonda Seeley-Thomas, Chief Medical Officer of Antigua and Barbuda. Stay with us.
I want them to get that experience that I had because it wasn't a nice experience. To me, I was close to death. That's how I saw it. When COVID just came out, to be honest, I thought it was a hoax that people just say COVID, blah, blah, blah. Then after I got it, it's no joke. It's not a joke thing. That's a serious thing. COVID is real. People would say it's towers and all of that. I ain't think any tower will make you so sick. And people need to realize that it is true. It is real. A lot of people have died out of it. And a lot of people get sick out of it. And people would say, oh, the elderly will get it. No. Young people, I know young people like younger than me who died. A good friend of mine, son, which I know very well, son died in Vieux-Fort. I just told me yesterday that a bus driver that I know very well died. I know a farmer of mine who used to sell me coconuts died on Sunday. So it is real. And I say, but listen, boy, I got a chance that these people didn't get to tell people COVID is real and they have to be careful. Wear your mask, sanitize. I'm in a couple of groups and I've told my partners in the sound group, say, let's keep the music down for now. I love music. Music is everything for me. But now I cannot go out and sit down by the road or sit down by the beach with my friends, play music and sit down and have a drink because of COVID. Because you never know who would come around and they have COVID and will just come and talk to you and then boom, you get it again. But I'm being very precautious. I always have my mask, I have my sanitizer, and I don't go in large crowds. I stay away from it, period.
We thank you for continuing to stay with us right here on this special program. It's called COVID-19 Vaccines, a healthy dose of the facts. You're here in the studios of ABS Television and Radio in St. John's, Antigua, and a warm welcome wherever you're joining us across the OECS. Joining us now, as we promised you, is Antigua and Barbuda's Chief Medical Officer, Dr. Rhonda Seeley-Thomas. We're continuing this discussion to ensure that you have all the facts you need to make informed decisions. Dr. Seeley-Thomas, thank you so much for joining us. We're 6 feet apart in the studio, so we're following the protocols. Let's start off here in terms of the situation with COVID-19 in Antigua and Barbuda. How has it been generally?
Very serious over the past few weeks, Mr. Burford. We've seen an increase in the number of cases since July of 2021. And currently, as of September 22nd, 2021, we have had 2,923 confirmed cases of COVID-19 in Antigua and Barbuda. We've had about 64 deaths and approximately between 50 to 55 persons in our hospitalized actually at the Celeste Bird Medical Center on average since the increase in the number of cases. And we currently have, as of September 22nd, 977 confirmed cases of the disease.
And we've had a significant number of those deaths in the recent weeks, haven't we?
Yes, we have, unfortunately, and condolences to all the family members who would have been affected by this.
Dr. Seeley-Thomas, is this emerging more as a pandemic of the unvaccinated? That term, that phrase has been used a lot. Have you seen that here in Antigua and Barbuda?
Yes, from preliminary investigation into the confirmed cases that we've had here in Antigua and Barbuda, a significant number of them, between 70 to 80% and even higher, have been unvaccinated. In terms of the deaths, each time we do have a death reported, I personally check our vaccination register to see whether or not persons would have been vaccinated. And according to our records, persons who have died have not been fully vaccinated against COVID-19. And I want to stress fully vaccinated because persons might have gotten 1 dose of a vaccine or even 2 doses And, but the 2-week period would qualify them for being fully vaccinated, that criteria may not have been met.
Well, and of course, we remind our viewers and our listeners that to be fully vaccinated, it would be 2 weeks after the last dose, which is either the second dose of a 2-dose or 1 dose of a 1-dose.
Yes.
Let's talk about how the vaccination campaign has been progressing in Antigua and Barbuda. We mentioned earlier the number is now 40.6% of the population being fully vaccinated as of last Friday. How are you satisfied with the level at which it has been going?
I'm not satisfied. I wish more persons would have come out to get vaccinated. We have 5 vaccines that are available in Antigua and Barbuda: the Pfizer, the AstraZeneca, Oxford AstraZeneca, we have Sinopharm, we have Sputnik, and we have the Johnson & Johnson, quite a wide variety, so people actually do have a choice. Our vaccination program began in February of this year, and as you said, over 40,000 persons vaccinated. Over 40,000 as well would have had have been fully vaccinated, and fortunately for us as well, we have the Pfizer vaccine, which is also available for children over 12 years. And I've been told today that about approximately 4,000 of those children, that population, have been vaccinated against COVID-19. So
4,000.
Very good. Yes.
Excellent. That's excellent figures in terms of the uptake among that age group. And possibly there's talk about a vaccine for children even younger. That is still in the works.
That's still in the works, and we're very hopeful that that would certainly have an impact on protecting children in that age group, but also have a very great impact in bringing us closer to herd immunity.
Absolutely. The evidence, Dr. Celia Thomas, that vaccines are working, from the figures, do we have that information that the vaccines are actually working as intended?
So let's go to do a little history, sorry to say, but we know that vaccines work from childhood preventable diseases like measles, polio, chickenpox. We do know that vaccines work. With regard to COVID-19 vaccines, there were clinical trials which would have identified the efficacy of these vaccines. And we know that vaccines like the Pfizer, the Moderna, efficacy in the 90s, AstraZeneca, efficacy in the 74, 75%. What has been happening since so many billions of doses of the vaccine have been administered, we're now seeing the real world data. We're now seeing the evidence that vaccines work. The time has been short for studies to be done, but some have been done, a few. In fact, 5 countries participated in a study recently, and those results have been published. And what it has shown is that the vaccines, COVID-19 vaccines, have been effective in preventing, have been more than 80% effective in preventing disease transmission and hospitalizations. If we look a little closer, for example, the AstraZeneca, I mentioned efficacy in the clinical trials of 74%. What the real-time data is showing is that for AstraZeneca, the effectiveness of the vaccine is even better, 85% in the real world, now that the vaccine is actually being administered. And that has actually been demonstrated in the United Kingdom.
Excellent, excellent. And therefore, finally, your message to not only here in Antigua and Barbuda, but those watching across the sub-region at this hour.
My message is to take COVID-19 seriously. We see the figures, the number of hospitalizations and the number of deaths. We know that the variants are there, and the variant is working, and we have to work to counteract the effect of the variant. Persons must obey the protocols, the public health measures that we do work. We know that work, the mask wearing, the staying 6 feet apart, avoiding social situations, and being healthy. Rest, adequate rest, exercise, boosting your immune system, that helps the vaccines to work. You have taken your vitamins. So that's my message basically to persons, to obey the protocols, remain healthy. To my colleagues, I want to let them know that they should remain strong. The healthcare workers on the front line, we really appreciate all that you've been doing, and continue to work hard, observe the protocols as well. And I must use the opportunity to thank our sub-regional partners and institutions, the OECS Secretariat for, of course, organizing this wonderful session, CARFA, who's been assisting us with testing, and of course, the Pan American Health Organization, PAHO.
Dr. Celia Thomas, well said, and thank you too for your indefatigable work, your amazing contribution to healthcare delivery, not only in this country, but across the sub-region. I mean, a grateful nation says thanks. Thank you much. Really appreciate it.
Welcome.
Dr. Rhonda Sealy-Thomas, of course, our thanks to her and her team, of course, for giving us that update on Antigua and Barbuda with a clarion message on vaccination, making it very clear vaccines are working. And now, here is a message to you from some of the sub-region's doctors on the front lines in the battle against COVID-19.
Hello, my name is Dr. Georgette Skerritt, a medical officer within the Ministry of Health and Social Services in Montserrat. I would like to encourage all persons to get vaccinated against COVID-19. In Montserrat, we have recorded 33 cases and 1 death since the start of the pandemic last year. This has been a significant number since our population is less than 5,000. In order to prevent any serious illness, further hospitalizations and deaths, I encourage all persons to get vaccinated. In addition, remember to wear your mask, wash your hands frequently, and keep your social distance of 6 feet away from other persons. Thank you.
Okay, good day. My name is Dr. Ronald Georges. I am the Acting Chief Medical Officer in the Ministry of Health. As persons may be aware, we are presently seeing a small increase in cases. At this point, it's the beginning and we don't know what might happen. However, we have to be concerned that if we do see further increases, what may happen. So right now, we have to be concerned that we have to adhere as strictly as possible to our public health measures and vaccination. So those are basically the 2 major steps or 2 major things that we have to control outbreaks. Public health measures is very important. We've had lots of discussions on public health measures. Everyone knows there's mask wearing, hand hygiene. You have to stay 6 feet apart from each other, and all the other measures that we talk about continuously. The second thing is vaccination. So we all know that vaccination may not necessarily completely prevent you from becoming infected or ill, but vaccination has been shown to severely reduce the impact of coronavirus illness. So persons who are vaccinated do not have serious disease, they generally are not hospitalized, and they generally do not die. So vaccination is incredibly important at this present time to, 1, increase our vaccination coverage rates, particularly among those who are susceptible. We all know that persons who have chronic diseases such as diabetes, hypertension, any sort of autoimmune disease, respiratory diseases are much more at risk of the more severe impacts of coronavirus. And those are the persons particularly who we need to ensure are protected as much as possible. So as far as possible, persons like this should try to be vaccinated. We consider you to be fully vaccinated when you are 14 days after having 2 doses of a 2-dose vaccine or 14 days after a single-dose vaccine. So we in the Ministry of Health, Government of the Virgin Islands, encourage you, if you have not made that decision as yet, to make the decision and get vaccinated and get yourself protected against coronavirus.
From a COVID-19 survivor in Antigua and Barbuda who spent months in hospital. Take a listen.
I would say get vaccinated, protect yourself, protect your loved ones, everyone around you.
And look at that. You are now on your way to recovery, and we just had to do a promotion for your sister, who you are now turning around to help.
Yes.
So you see, God wanted you here for a reason.
Definitely, definitely.
Family is everything.
And I would say I have the best family that anyone could have.
You have many reasons for living.
Yes. Oh yes. Without my family, without my mother, my sister, my son, I have a 6-year-old son. He'll be 7 tomorrow.
DJ Keith Dover's story never gets old. One of the most compelling stories you'll ever hear is from Antigua and Barbuda, months in hospital, COVID-19 survivor. That's it for COVID-19 vaccines, a healthy dose of the facts. Our thanks to all of the medical professionals who joined us for this broadcast, and to you for joining us across the 11-member grouping of the OECS and beyond. I'm Garfield Burford. The discussion continues online, and here's a look at where you can continue to get clear and factual information on the virus, the variants, and vaccines. You'll be able to look at these pages for factual information on the coronavirus. On behalf of all the government information services across the OECS, I'm Garfield Burford. Be safe and good evening.